To measure shoulder flexion, what you want to do is have the patient lay in supine, make sure their legs are in a comfortable position. Unless, of course, the patient cannot tolerate being in supine, you can also measure shoulder flexion in sitting. The axis of rotation for shoulder flexion is 2.5 centimeters or 1 inch inferior to the lateral acromion process. So you'll palpate over here and determine where your axis is. Ask the patient to flex their shoulder. And the trick at this point is to not let your finger move with the flexion of the shoulder, but to keep it constant at the axis of rotation. At this point, you'll place the center of your goniometer over the axis of rotation, and your stable arm is going to be parallel to the longitudinal axis of the trunk. Once you have that set, the movement arm of the goniometer moves along the longitudinal axis of the humerus. An easy way to find that is to palpate the humerus, look for the lateral epicondyle, and point your movement arm towards that. In this case, we are reading 154 degrees of shoulder flexion, where a normal range of shoulder flexion is 0 to 180 degrees.